Polymyositis by Joanna, Gabby, Ben, Ashley, Anarie, and Bonnie.
What is polymyositis? Polymyositis, or PM, is a rare inflammatory disease that causes muscle weakness on both sides of the body. It's a type of chronic inflammatory myopathy, which refers to a group of muscle disease characterized by chronic inflammation and resulting in muscle weakness. Muscle weakness can develop over a period of days, weeks, or even months. These weakness often lead to difficulties going up the stairs, rising from a chair, or even combing hair. Muscle weakness is typically symmetrical, same on both sides, and affects the proximal muscles closest to the body core, such as the hips, thighs, upper arms, shoulders, and the neck.
So the history of polymyositis begins in 1863 when Ernst Leberecht Wagner and Heinrich Unverricht discover the disease of polymyositis. The two men discovered together, and Wagner publishes a paper regarding the disease in this year. In 1875, 12 years later, a man by the name Dr. Potain, he became the first man to publish a case of dermatomyositis, which is closely related to polymyositis. Later in 1886, Uverecht became the first man who described polymyositis in a more detailed description in the best way he could. And after that, we fast forward to 1887, and Wagner publishes a second paper describing the disease and his new findings. Fast forward again one more time to 1891, where Unverricht creates the designation for the disease, and this designation is about how it is used and how we know it today. And then we do one more fast forward in the history of polymyositis, and this is the second part, all the way up till 1975. So almost 50 years ago, 48 years ago, Anthony Bohan and James V. Peter, two physicians, classify two diseases of polymyositis and dermatomyositis. These diseases were then broken up into 5 subtypes, which include the primary idiopathic polymyositis, primary idiopathic dermatomyositis, DMPM associated with neoplasia, childhood, DMPM associated with vasculitis, and DMPM with associated collagen vascular disease. So as it's understood, polymyositis and dermatomyositis are close related, and this is the full history, fully encircling polymyositis. Thank you for listening, and have a great day.
The signs and symptoms of polymyositis are muscle pain and stiffness, muscle weakness in the abdomen, shoulders, upper arms, and hips, problems with swallowing, irregular heart rhythms, and trouble catching your breath. I've added a picture of a normal heartbeat, which is the top one, and then an irregular heartbeat, which is the bottom one, and there's like a slight difference where the heart just like kind of stops for a longer period of time. If a muscle weakens too much, it can lead to trouble eating and swallowing, which then can cause weight loss and poor nutrition.
Moving on to risk factors. Having other autoimmune conditions such as lupus, rheumatoid arthritis, and Sturgeon's syndrome may increase your chance of being diagnosed with polymyositis, since these autoimmune conditions do go hand in hand with the disease itself. Surprisingly, HIV can also increase the chance of being diagnosed with PM, since there is muscle involvement in an HIV infection. Another risk factor is having a respiratory disorder. If an individual has been diagnosed with interstitial lung disease, this can lead to scarring, fibrosis of the lung tissue. Homeostasis within the body can be affected due to the body level changes on a daily basis. A lack of protein can also be found to impact homeostasis, as it is a crucial balance to maintain healthy muscle cells. In addition, having polymyositis can put you at a higher risk of having dermatomyositis, which is irritation or rashes. It's inflammation on the skin due to intake of medications like steroids and immunodeficiency drugs, as well as the heart and lungs can surprisingly be affected as well. Individuals with this disease can have a higher chance of developing heart arrhythmias and interstitial lung disease. To avoid these issues from occurring, patients must see their primary doctor for regular checkups. Polymyositis affects normal homeostasis within the body due to the abnormal number of cystotoxic lymphocytes and macrophages. These are cells that are against muscular antigens. This is a problem because this results in rhabdomyolysis production, which presents as proximal myopathy, which then progresses if not caught, and the body will become weak.
On the next slide, I'll be talking about mechanism, which is the sliding filament theory of muscle contraction. The sliding filament theory occurs on the sarcomere. The sarcomere is part of the myofibril, and the myofibril is found in the muscle fiber. A sarcomere is the basic contractile unit of muscle fiber. It is where contraction and relaxation occurs. It is a region from one Z-disc to the next, and it is made up of the A-band, where relaxation occurs, the I-band, which is the lighter band containing actin only or thin filaments. Then it has the H-zone, which contains thick filaments only, also known as the myosin filaments, and the M-line, which runs down the center of the sarcomere through the myosin filaments. It can be seen on this picture. We have the Z-disc. The Z-disc is this zigzag green line right here on the left and the right side, which shows that this is the sarcomere from one Z-disc to the next. And then we have the H-zone, which is these thick lines, thick purple lines. And then we have the green thin lines, which are the I-band. And then we have the A-band, which is where relaxation occurs. And then we have the M-band, which runs down the myosin filament, like I have said before. On the next slide, I will show how muscle contraction works. The muscle contraction results from the interaction between the I-band and the H-zone, the actin and myosin filaments. They generate movement in relation to each other. During muscle contraction, sarcomere shortens, bringing the Z-discs closer to each other. The sarcomere becomes short. Those blue lines right there, on this picture they are blue. The Z lines, they are blue. Like the zigzag lines, they are blue. They come closer to each other, pushing the thin filament towards each other as well, and the thick filaments towards each other.
Diagnose. Polymyositis is a disease diagnosed through a physician exam and blood testing. It is often associated with high levels of muscle enzymes, which are released into the blood by damaged muscles. EMG and nerve conduction tests can also show abnormal findings and rule out other nerve muscle disease. Muscle biopsy can confirm the presence of muscle inflammation typical of polymyositis. MRI can also confirm inflammation in the body.
The prognosis of polymyositis is 1 in every 5 people may die within 5 years of being diagnosed. Five-year survival rate is estimated to be greater than 80%.
Complications of polymyositis. If polymyositis is not treated, it can lead to complications such as trouble swallowing. If the muscles in your esophagus are affected, you may have problems swallowing, which can turn into weight loss or malnutrition. Another complication is aspiration pneumonia. This is difficulty swallowing may cause you to breathe foods or liquids, including saliva, into your lungs, which can lead to pneumonia. Another complication is breathing problems. If your chest muscles are affected by the disease, you may experience breathing problems such as shortness of breath or, in severe cases, respiratory failure. How does polymyositis affect the immune system? The cause of polymyositis has not been found, but the evidence showed it is most likely an autoimmune disorder. Immune cells mistakenly attack muscle fibers. If a biopsy is taken of an affected muscle, it will show inflamed cells. Muscle tissues become damaged by the immune system as it tries to get rid of tissue of a viral infection. The immune system attacks healthy muscle tissue, which result in inflammation, swelling, pain, and eventually weakness.
Now on to treatment. There are two types of medicines. First one is anti-inflammatory medicines. These are steroids medicines or corticosteroids that ease inflammation in the body. Immunosuppressive medicines. These are medicines that block or slow down your body's immune system. Now on to therapy. Physical therapies. These include special exercise to help stretch and strain the muscles. This can help keep muscles from shrinking. Speech therapy is another therapy that helps with swallowing muscles that have been weakened by polymyositis. Dietetic assessment helps with chewing and swallowing. A registered dietitian can help teach how to prepare easy-to-eat, nutritious food. Occupational therapy helps with activity of daily living and improving overall functional ability.
Lastly, here are the sources that we used.